Welcome back to another video. Today I am going to be digressing a little bit. It won't be a transcription video. This will just be my thoughts and opinions regarding evangelicals and some of their hypocrisy when it comes to things like the UnitedHealthcare CEO being murdered this past week. In preparation for this video, I went and looked back at my emails. I used to be, when I was a young evangelical growing up, I used to be a huge fan of Breakpoint. Because I thought at the time, when I was growing up, I grew up Wells. And Wells did not want to touch, let alone talk about, many topics. And Breakpoint seemed like they were discussing these topics fairly and honestly to me, being a young evangelical, so I subscribed and listened to a lot of it. I also grew up listening to it because my parents were huge fans of it as well. Here, archived in my email, is an email from October 11th, 2016. I should give a little context. Breakpoint is a 5 to 10 minute blog that is read by either Chuck Colson or, after he died, John Stonestreet and Eric Metaxas. And it's usually not only posted as a blog post to their website under the name Breakpoint, but it's also read out and transcribed by these guys and sent to Christian radio stations to be broadcasted. The idea behind Breakpoint is that it's a 5 to 10 minute audio clip regarding certain, they would see them as important issues of the day and they would discuss them. Out of curiosity, I did look at their website and I tried a couple of things searching for any sort of statement regarding the UnitedHealthcare CEO killing last week. I have not seen anything on their website, but I could be mistaken. If you've seen something on their website regarding the UnitedHealthcare CEO being killed and you would like to share that link, please do so in the comments down below. I find it interesting that, considering how poignant of a topic that is and how poignant of a topic healthcare has become because of the UnitedHealthcare CEO's killing, that they haven't done a Breakpoint episode on it. However, I think that has to do with what I'm about to discuss today, and that is evangelicals regarding healthcare and their somewhat hypocritical stances on privatized healthcare versus government healthcare. And again, I'm referring back to this email from 2016 that was archived in my inbox because of the topic that they will choose to point at the most when they talk about death boards. Usually when evangelicals talk about death boards, they don't see them as an issue in privatized healthcare. They only see them as an issue in government-run healthcare. And side note, this is not me excusing any sort of death boards or death legislation. This is me merely pointing out the hypocrisy that evangelicals hold when it comes to talking about this. Because as we see here, Breakpoint back in October 11th, 2016 was titled "A Suicidal Ballot in Colorado. Will the right to die become a duty to die?" And then in this Breakpoint, they talk about parishioners being, in Canada back in 2016, being diagnosed with cancer, and how the first thing they were supposedly asked was, "Do you wish to be euthanized?" No citation given. And they're labeling this as something that's even worse than cancer. Now, what does this do or have to do with government-run death boards? They go on to reference Belgium, where in the 14 years Belgium went, and I'm paraphrasing here, from euthanizing terminally ill adults to killing chronically ill adults to offing adults who had lost their will to live to finally disposing of children. See how here Eric Metaxas has, was it Eric Metaxas? No, John Stonestreet. Here John Stonestreet is lumping in multiple different medical categories of patients. And he does so, again, without a citation listed here specifically for 14 years that Belgium supposedly went and did these government-run death boards where now they're, or at least back in 2016, he's insinuating that they're disposing of children, as if disposing of children is something new that Belgium decided that they were going to do. Now, I can understand, yes, this is a blog post and maybe they have resources at the bottom. The resources, at the bottom, they only discuss two, and they're both books written by Scott Klusendorf. Anything else that isn't written by Scott Klusendorf or doesn't appear to be written by a Christian author, they do not reference it here. So that's a major red flag. Not that I would have known that back then, but I do now. If they cannot provide resources listing all of this supposed right to die in euthanasia, you would think that the first thing they would do is include links to news articles talking about assisted suicide / euthanasia / right to die / government run death board discrepancies or cases where there was controversy over a decision one of the death boards made. But they don't, at least not here. And from a cursory search of the other emails that I've been pulling that have been regarding this topic, they don't provide a lot of resources in those either. Again, if I am wrong, please link it in the comments down below. Now, I can understand the question that you may very well have. Why am I discussing government-run death boards? Because as much as evangelicals like the Colson Center, like Chuck Colson, and like the people who took over the Colson Center after he died, Stonestreet and Metaxas, as much as they like to point out how bad government death boards are, they do not have any words to say about privatized healthcare death boards. They have no words. That's my reasoning, my guess, as to why they haven't discussed the UnitedHealthcare CEO killing. Because as a Christian, yes, on the one hand, we can definitely say it was murder, it was premeditated, it was the taking of a life. However, also as a Christian, we can look at that CEO and say that as of reporting, and I will link it here in the description below, he's spent however many decades as a CEO of UnitedHealthcare, and UnitedHealthcare was responsible for at least 32% denied claims in the last year alone. And what do denied claims do? Denied claims means bankruptcy and perpetual medical debt for people who have no way to pay it off, no means to pay it off, at least not immediately. And for many of them, this is probably going to be reoccurring issues that they will have to figure out how to deal with for the rest of their life. And they have no way of actually paying for it, not in full. And insurance companies know that. And insurance companies know that they might be breaking the law, but for them to be caught breaking the law, you have to be a patient with the money and the means to catch them and to lawyer up and to go after them in court and to spend years of your life and stress and sanity to take them to task for what they are doing to you. And that's just one person. That's not counting the however many millions of people that had these denied claims. But insurance companies can do this because they're privatized healthcare, and evangelicals will not touch privatized healthcare with a 10-foot pole, because to them, privatized healthcare is perfectly fine. Privatized healthcare is the market working. Privatized healthcare, for all of its errors, is still better than government-run healthcare, because, well, thank God the government isn't intervening into the regular Joe's life to determine whether he should live or die. But they will never say anything about the people who are dying because of privatized health care and insurance companies deciding who gets to live and who gets to die. Sure, it might not be as direct as euthanasia, but it is still a lot closer and a lot more direct than anybody, including evangelicals, want to admit. They are responsible. Private healthcare and private insurance companies are responsible for people deciding whether or not they get the treatment that can save their lives or that can end their lives. Privatized healthcare decides how much medical debt a person is going to be subject to for the rest of their life. Privatized healthcare runs their own version of death boards, and evangelicals will never discuss this. They much rather attack government, which does and will overstep their bounds as a general rule of thumb. But at least against governments, you have the ability of eventually coercing them, using public opinion, using other governments' public opinions of them to coerce them to do something right. Insurance companies have the money and the lobbyists and all of the people that they pay to continue to have the privilege of running other companies to deny your medical claims. And they, generally speaking, cannot be held accountable like governments can and very well should continue to be. Privatized healthcare can do a lot of good things, but it is also, as a lot of us have witnessed over in the past couple of years, they can do a lot of damage, and they will continue to do a lot of damage. But again, evangelicals don't care. They want to conflate people who are speaking up against privatized healthcare, private insurance companies, and the companies that insurers use to deny claims. They want to obfuscate that and act as if everyone wants just free government healthcare. Well, let's talk about government healthcare, shall we? I already pay between $200 to $300 for insurance per pay period. That means over the course of a general work year, I spend between $5.2 thousand to $7.2 thousand. Sometimes more, sometimes less. Again, that depends on when pay periods fall. My deductible at my current job is somewhere around $10,000, which honestly is better than the deductible at my previous employers, which was around $20,000. If something bad were to happen to me where I go into the hospital, I have to think about how much money the medical costs are going to be. Because just because a deductible is met doesn't mean that 100% of the costs are going to be met. Or even if, say, the insurance company comes back and says initially, just to get the procedure going that may or may not be needed, they say, yes, that's covered. And then, say I get that procedure and then I leave, and then the insurance company goes, well, actually, our claims adjuster denied that procedure. Now there's potentially tens of thousands of dollars of medical bills on the line, and there's a lot of calling and negotiation and demands that the medical companies and the hoops that have to be, that me as an average person who doesn't make a whole lot of money has to jump through in order for anything to be considered, whether it's trying to get my claim fully covered, like insurance claimed that they were going to cover, if I am even going to be able to get part of that claim covered. And that's not even counting if, say, someone has a deductible and after that it's 80% is met by the insurer and then 20% is met by them. That's still potentially thousands and thousands of dollars that they will accrue in medical debt. The people who are talking about Medicare for all and talking about how the government option, whatever government option there might be, if it's established in the market, has to be the bare threshold that private insurers have to be held to a standard in order to be able to continue to compete as private health care. If that is the standard of, if the people who are proponents for Medicare for all say that that is the base standard, I'm still going to be spending the roughly $200 to $300 per pay period. But instead of it going to private insurance who can deny my claims based off of whatever bullshit they spew, that will be going instead to a base level of standard of care set with rules and regulations. And those standards of rules and regulations, yes, can it become archaic? Can it become bloated? Absolutely. But those base standard of regulations for health insurance for someone like me who makes less than $50,000 a year can also have more standards set up where if there's a certain level of medical debt reached, they can't hold the amount that goes over that threshold against me. Which, say if there's a chronic condition, say that there's some sort of chronic health condition that comes up, that private insurance companies are known to deny claims for that, leading to tens of thousands of dollars of medical debt that accumulate for other families. Versus you have that system versus you have Medicare for all, where you establish a threshold and then people who are disabled, and then you make it so that every year it has to be renewed. Again, it's not going to be perfect, but the benefit that Medicare for all has versus these private insurance companies is that it is going to force them to a base government standard, which other countries do have, and they have made it work. But evangelicals, again, will focus immensely and heavily on, well, as soon as you have a base level of insurance that's provided by government, then you have government-run death boards. And now you're encouraging the government to, you're incentivizing the government to kill everybody. Private insurance is already incentivized to kill people. You just don't want to talk about it. Come up with a different argument. Because as Christians, you should be against death boards, whether it's the government that are driving them or if it's private insurance. And right now, private insurance drives a lot more people to financial ruin and suicide and depression and death than government, at least here in the United States. Anyway, thanks for listening to my rambling on the healthcare system and on the hypocrisy of evangelicals like John Stonestreet and Eric Metaxas here at the Colson Center. Let me know if you'd be interested in me going over any of the archived emails that I have available, because boy, do I have a lot of them. Take care of yourselves, and I will see you in the next video. Thank you.